in terms of how the future would look like, or ideally how I would like to see it, is that when the patient comes with a suspected valvular heart disease, and it's not yet time to operate according to the guidelines, sometimes it's a little bit vague how often do we need to follow that patient. So it would be very good to have a sort of artificial intelligence tool, for example, that could tell me, based on this data that you have on this patient, it would be better to follow up him or her every 6 months because probably the progression is going to be fast and you will need to operate soon. Or the other way around, you have a patient that is sort of moderate aortic stenosis, for example, and the left ventricular systolic function is not completely perfect because had in the past some myocardial infarction, but now the coronary arteries are stable, there are no new lesions, and you are concerned on how fast that aortic stenosis is going to progress. So if we would have data from millions of patients or thousands of patients that could give us a clue on how often this patient needs to be followed in order to pick the patient at the right time to operate and to have the best results, that would be great. If those data from that will give the tool of artificial intelligence will come only from imaging or a combination of biomarkers, for example, NT-proBNP or troponin, or echocardiography together with CT, echocardiography together with a magnetic resonance, where we can assess the tissue characteristics of the ventricle, for example, that would be ideal. And if that could be spread and everybody follow the same systematic approach, that will facilitate very much the follow-up of those patients and make easier the planning of the outpatient clinic. Right now, many outpatient clinics are crowded, are overbooked sometimes, and because there are patients that maybe would not need such a strict follow-up, or there are patients that will need a much more strict follow-up, but because there is an overbooking or there is no enough time, they will not get it. So if we could have a tool that indicates to us which is the patient that really needs this follow-up and which is the patient that we can prolong the follow-up much later or do it every 2 years, that would be good. For example, one of the diseases where there are no much data on how do we need to follow up the patients are patients with bicuspid aortic valve. And bicuspid aortic valve is one of the diseases that is the most frequent congenital heart disease. And some of the patients will develop aortic regurgitation, some of the patients will develop aortic stenosis, and some of the patients will develop problems on the aorta. If the problems of the aorta in terms of dilation and aneurysm are related to the anomalous flow of the aortic valve or not is not known, and we don't know if this is related to genetics. So these are many questions that are still unknown, and there is much research behind that in order to pick up the patients that will need a closer follow-up because the aortic valve will degenerate faster and will develop a severe aortic stenosis, or will develop an aortic regurgitation, or will develop an aneurysm of the ascending aorta, and we will need to operate on them. So this is a group of patients where the combination of several imaging modalities, echo, CT, magnetic resonance, in order to assess the flow will help, and where artificial intelligence maybe will help to decide how often we need to follow up a patient with that right now has a normal functioning bicuspid aortic valve. Do we follow up him or her every 2 years, every 3 years, every 5 years? Sometimes the patients move somewhere else. So if they can have with them that data or that sort of phenotyping at that moment and take it as a sort of ID card to another center where they can also integrate those informations into their system, that would be great. It's a sort of what we had here in Leiden University Medical Center, the concept of the chip of the patient. So you have this condition right now, I don't want to say problem or disease, you have this condition right now, at this time point looks like this, How it will be in the future, right now we are working on that. We don't know, but we can compare this information at this time point if you go somewhere else in 10 years, how it was looking like, and see how the disease developed. So that would be sort of ideal situation for patients to have a sort of ID in terms of the cardiac condition at that moment.